I think that the EAU live surgery is particularly special because we include many live surgeries and semi-live, and because we perform very modern and unique surgeries, and people love that. So they come to see the novelties in the market, they come to see the new instruments available. It's a very technical session, so people can really enjoy what's new in the market, the new kids on the block. So, and performed by among the best surgeons in the world. So I think that's truly the special part of the EAU live surgery. One of the tricky part of the live surgery event, any live surgery event, is the preparation, because everything has to be perfect. Right? The transmission, the broadcasting, and therefore we are looking for hospitals that are used to perform live surgery events. This seems like easy, but it's not, because not many are used to perform live surgeries. And that's why when we go and we land in some big cities, like in this case in the UK, in London, we already selected 4 of the I would say best hospitals, not necessarily the best hospital in town, but those who are very experienced with that. And so we have 4 hospitals in London, plus we retransmit from 3 extra hospitals abroad. And that's important because that opens and paves the way to what we will probably show during this live event, which is the telesurgery, and not necessarily retransmission, but also telesurgery, which is a different concept. And you've seen this during the EAUs this year, so we will see more and more this concept of telesurgery. The live surgery event of the EAU mix the world of endo-urology to the world of robotic surgery. So there are basically 2 parts. So the first part is endo-urology, the second part is robotic surgery. So we always try to show what's new, as I said before. So this year, for instance, there are new lasers in the market. There are new instruments that will be shown, new endoscopic instruments. So the audience can take advantage of seeing, sometimes for the first time, the particular laser that they may be interested in acquiring in the future. And as far as robotic surgery, you know, we showed this at EAUs, but now even here in the live surgery event of the EAU, there are new platforms in the market. And for instance, Intuitive now, they have a full range of oil available with the CE mark in Europe. So not to speak about the SP, but also the new DV5. The new DV5 is now available in some centers. One is in London, so we will have it from London. But the other one is from Germany, so we will retransmit from Germany, and Christian Wagner will perform a DV5 procedure from Grenoble, Germany. And the same is for Medtronic. Medtronic will show you know, different surgeries retransmitted from abroad. But we also have Tomai from Microport. We have Edge Medical, and other companies that are willing to join us. So again, you know, not necessarily new things, because for instance, Microport and Edge, we also showed it during the EAUs this year, but certainly procedures that are performed worldwide with these new machines. Well, as you may know me, I'm a big fan of live surgery. Not that I don't like semi-live or pre-recorded. As a teaching purpose, pre-recorded and semi-live are very good, but they are not the real world scenario. As far as education purposes, I think live surgery is the real world. So if something goes wrong, for instance, in the theater, and not necessarily there's a complication, but an instrument is not working, we see how it is solved. To do that, we need to have experts. So the surgeons that we select are selected by the company, but also by us, and are talented surgeons. Not everybody can do live surgery. You can be the best surgeon in the world, but to be in front of 2,000 people and being able not to be frustrated or to be anxious in front of those people is not easy. It's not an easy game, and so the surgeons that are operating are not only good surgeons, but also very used to do live surgery. And we learn from that. Because if there is, as I said, a problem, not necessarily complications, but again, a problem, a technical problem, or a complication, which can occur, we see how the complication is solved. And that is not what you normally see on a semi-live.